Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I am happy to welcome Dr. Kelly Fiala. You are the Dean of the College in Health and Human Services here at Salisbury University. Thanks for coming in.
Thanks for having me.
And of course, we are physically distanced.
Yes.
And the topic for today is a little bit about COVID-19, and more specifically, however, more about the College of Health and Human Services and the new Center for Healthy Communities that has been established now. So I think you first want to talk about SU's role in both public and community health.
Absolutely. So the College of Health and Human Services was just established a few short years ago. And so that's given us the opportunity to collaborate across all of these disciplines to provide more services to the community. But what we're really known for at SU is our workforce development and really putting students into the fields, letting them have these great clinical experiences, field experiences, and internship experiences, and preparing them to work in those careers as health and human service providers. So that is probably our most significant role, certainly in line with the mission, but we have also a desire to do more with community engagement. And so we've done some workforce development with that, with with continuing education, professional continuing education, where we have providers come and participate in courses, conferences with us to earn continuing education towards maintaining their licensure. And the other thing that I'm very, very proud of is the number of grants. So we really leverage our faculty and staff who have great skills, and they're able to obtain grants from state agencies, federal agencies, other philanthropic organizations to serve the community. And some of those grants are around workforce developments. You're very familiar with the ones in nursing, so trying to take practitioners and help them become educators, and that's a really important piece of that. We also have several in the School of Social Work, where we're putting student interns that already have obtained their BASW degree, and they're earning their master's degree. And we have a great grant that's a partnership with the University of Maryland School of Medicine and Johns Hopkins School of Medicine, where we're putting those students into pediatric practices for early intervention. And there's other collaborations I could go on about substance abuse disorders, and certainly about childhood mental health that we're working on. So we do see ourselves as providing a lot of service to the community in terms beyond producing health and human service providers.
Well, maybe before we get more into some of these hands-on programs, just remind our viewers, the School of Nursing is included in the CHHS, and of course you mentioned social work.
That's right.
And then what other disciplines are under the College of Health and Human Services?
Sure. So we have a third school, which is our School of Health Sciences. So basically it's everything that's left, and it has smaller programs. So we have athletic training, applied health physiology. We have our community health, which is public health at the community level. We have exercise science, and we have respiratory therapy and medical lab science. So there's 6 other academic majors or graduate programs that are within that School of Health Science that make up the college.
And I know one of the things you wanted to talk about is how is the COVID pandemic that's going on affect students in terms of these hands-on programs?
Yeah, you know, this spring was really interesting, and I know you can probably reflect on that too from your perspective, but we went from having some general conversations about what if we had to go online, in a short week being fully online as we made the announcement that we weren't coming back after spring break. So that took a lot of adaptation, and I'm so proud of the faculty and staff that made those things happen, but essentially our students went home. And so we used technology to maintain contact. So we taught classes over our Zoom technology, so at a distance. And so those hands-on experiences were limited. I will say that we got creative. Our faculty are incredibly creative. There were standardized patient encounters. So our standardized patients are in our Henson Medical Simulation Center. And they're actors, essentially. They act out different scenarios, and then the students can interact with them over that video conferencing and, you know, provide recommendations and have an interaction with that patient. So we were still able to do those things. The other thing we did, I know that we had several grandparents coming to class, aunts, uncles, and nieces that modeled for students. So in some of our classes where we had to do knee evaluations, Grandma was there on the video having her knee evaluated. We also used other technology that's been around for a while to introduce students to simulated experiences so they can continue to prepare. I would say the other thing that we weren't expecting to go fully online, but then the state gave us a push to say, what can you do to accelerate this experience for the students? And is there a way for students to meet graduation requirements in advance of that mid-May traditional graduation time? And again, the School of Nursing, School of Social Work, and our respiratory therapy program stepped up and accelerated the rate at which that curriculum was being delivered so that all of those students were done with their programs prior to May. And that helped out with provisional license opportunity and really trying to work with the state to serve the state. Of course, there's risks associated with putting out students before they have all of those experiences. So we worked hand in hand with the state to think about those orientations to new job experiences and how that hands-on experience would come, additional hands-on experience would come in that initial training as they joined the front line to provide services to patients with COVID.
Yes, some of these disciplines are quite key in all this.
Absolutely.
Nursing, respiratory therapy, and of course, you know, you mentioned the Richard A. Henson Medical Simulation Center was really important for nursing in particular, and I know it helped
Absolutely.
in other areas as well. So, just your thoughts, do you expect to see growth in some of these fields as a result of the pandemic?
Yeah, that's an interesting question, and I really do. I mean, if you look at the media right now, you know, nurses and respiratory therapists are frontline heroes. When have we used that kind of terminology in recent history? I can't think of a time. So, you know, we've certainly have the PR to support those professions. So I think we will get more interest. The thing for us is accommodating the interest that exists. So those are programs that are professional programs that students have to apply to get into. So they apply to the university, they get into the university. That does not guarantee a spot in nursing and respiratory therapy and the other professional programs, which are most of our programs in CHHS. So now we need to be creative about thinking, how do we accommodate those qualified applicants? Because we have had to turn away individuals that meet the qualifications, but we didn't have seats for. And I'm proud to say that we increased enrollment to the juniors coming into the respiratory therapy program by 25% this year. So working with the clinicians in the area to provide internship opportunities and the faculty of the program to meet the needs of an additional 6 students, which might not sound like a lot, but 6 more respiratory therapists a year. And we're also collaborating with nursing through some workforce development money from the state to consider our expansion opportunities there, because there is already interest in highly qualified candidates, and I think that this is just going to amp that up.
Yes, it's all good news, all the things that are
absolutely.
going on, and especially, I know you want to get to the really big news is about the new Center for Healthy Communities. So tell us about that.
So the Center for Healthy Communities was one of the first big initiatives, collaborations across the college. So the center is directed by Teresa Simmons, who's a licensed clinical social worker. She has over 20 years of practice, and then she's been at SU for the past 6 years working on grant-related opportunities. So she's been with us for quite some time, leading our child and adolescent behavioral health and education initiative. So now with the center, her role is to meet our mission, which is to create a healthier community around us. And that healthier community, we've defined that as being both mental and physical health. So the broadest definition, using different workforce initiatives, different grant opportunities, different service learning projects, and continuing ed to do that. So we're able to now centralize this. We've had the School of Nursing, the School of Social Work, and the School of Health Science have different opportunities, now pulling that together under her leadership to serve the community.
Now, when you say community, are you speaking the entire Eastern Shore or more localized?
Actually, I think of our community more as Maryland in general, certainly the Eastern Shore being the focus, but we have students and faculty and staff at different regional higher education centers across Maryland, and it's really rural Maryland to us. You know, so if you think about the Hagerstown area, Southern Maryland, or Cecil, those are where we have programs. And so our service, of course, the focus is on the Eastern Shore, but it does extend beyond that to rural Maryland in general.
And then how does this center, I imagine you're expecting to have or develop important partnerships,
Sure.
particularly with, say, local hospitals and other healthcare providers in the region. So tell us a little bit more about that.
Yeah, actually, we've had some great initial conversations. We still need more time. COVID did put the brakes on some of our plans, but we've had some great initial conversations with Peninsula Regional Health Systems. Catherine Fiddler is over there. She's a graduate, and she is actually our advisory board chair, about seeking some additional grant funding from the state, from the federal government, to do more with nurse-led practices. But in order to do that as the college, we need to have that partnership. We need to have a partnership with the practice. We can bring students in and engage them in different ways, and we can support our community. So we're beginning now to have those conversations. And I mentioned the advisory board. We have folks from AGH on the board. We have folks from agencies, across Delmarva, but also, like I said, across Maryland, and even beyond. So we hope to do a lot more of that with this center, and we'll be using the next year to really define a strategic plan. And we want input from the community. We want to hear from the community what makes us healthier. What do you need to know more about in terms of education? Where do we need to? We don't have the resources, but we're great at finding them. So where should we go, and what types of support should we look for to bring back to this community?
Yeah, resources, there's always grant money available is what you hear. It's just
Yep.
seeking that out.
Yep, and now we have an expert in this centralized director position, and a lot of eager faculty that have already been incredibly successful at obtaining those funds. So it's exciting to think about what we can do as a unit.
Well, it sounds like this center already has a good bit of expertise.
Mm-hmm.
So it's the resources, and you're saying the resources would be things like getting grants and so forth.
Absolutely. We're also looking at donor relationships too, because I think that people love to invest in higher ed, and they love to invest in scholarships, and people are very philanthropic towards Salisbury, and we have great relationships. But this is unique for individuals in our community that want to give back to the community that might not have a history with SU specifically, but this is a nice link to provide that support and provide those services back to the community. So we wouldn't rule out those opportunities either.
I guess COVID it's kind of delayed some things, yet
Sure.
it also creates
Sure.
an opportunity, I think, for people to realize how important health is, and
That's right.
these partnerships and collaborations. And of course, we know COVID is still evolving, so this will allow for opportunities for both the CHHS and the center to do some planning. I know you wanted to talk a little bit about that.
Yeah, so Teresa will be leading our strategic plan, and we have a committee that has those grant folks on there, those people with expertise, but also people that have done continuing education in the college. So we're looking at different opportunities. What are we going to become the experts in? We have a lot of expertise. So for example, your expertise in geriatric population is one of those expertise that we kind of identify with. Behavioral health is certainly an expertise in substance abuse and use. So trying to make sure that we're developing those expertise in areas that continue to support the community. But I think the input from the community in terms of what educational opportunities they would like. So we don't have to do all this formal professional continuing ed, but having educational opportunities for the community to come in and learn from these experts that we have. I hope that we're able to do more of that, because that is really the vision.
So what are some ways that, say, the community could get involved or provide feedback? Is there a vehicle for that?
Yeah, so we'll conduct a survey. We do, and actually the School of Social Work has done this in the past to get feedback from the community about what types of topics are of interest. But I would suggest that any community member that is really interested in having a more active role in that, reach out to Teresa Simmons to express that interest, because we are interested in having community advisory board around this and informing this group on what types of actions we should be taking. So we think we have an idea, but we don't want to make all those decisions without having community input.
Well, this is all so very exciting to have this new center as part of the CHHS, which in and of itself I think is just a great college. Of course, I'm a part of it, but
yes.
I think we're doing great things, and of course under your leadership. So hopefully we'll continue with some more ways to enhance the health of our surrounding community.
Yeah, we're looking forward to it.
So thank you for coming in today to share all this very important information about what's going on in the College of Health and Human Services.
You're very welcome. Thanks for having us.
And thank you for joining us for this edition of Focus on Health here on PAC 14.